attention.
Welcome back. Thanks so much for being here. We have Charles Grinder and Kelly Dix from the Baxter Regional Medical Center, from the Emergency Center, the Cline Emergency Center. Thank you so much for being here.
Thank you for having us.
Now, what do you guys do? I know that you're the director.
Yes, I'm the director, and basically I just help the people that help the people. So it's my job to make sure they have everything they need to help the people that come into the ER.
To come into the ER,
yes.
Okay. All right.
And I am the trauma coordinator.
Trauma coordinator, okay.
Baxter Regional is now a level 3 trauma center, and myself and Lacey Robb, and Lacey couldn't be with us today.
She's going to be really jealous.
But we are the trauma coordinators, and we kind of help keep the trauma center running, keep all the requirements for the state up, and keep a follow-up on patients as they come through.
Now, is this a new designation?
This is.
Okay.
December 5th.
So we've bumped up a notch.
We have. You know, prior to all of this, there was not a trauma system in the state of Arkansas. So a couple years ago, we started working on this, and now, through time, we have ourself, which is a level 3, along with 9 other level 3s in the state. And then we have 2 level 1s in the state and 4 level 2s in the state. So what that means is that when a patient comes into a emergency room, they should have all the equipment and the needed providers to be there to handle them, which is going to help our patients in this area as they come in, because patients that might have went somewhere else in the past now can stay at home and be closer to family.
Yeah, don't get air vac out, things like that.
Yeah, well, one good thing that I know a little bit about this, that when the EMTs are on scene of an injury or whatever, they can call a center in Little Rock. Is that right?
Yes.
And they'll know exactly whether they need to go to your center or somewhere else.
You bet. And you know, in an area kind of like here, we're a long way from another facility. We are, the closest level 3 trauma center to us would be over in Batesville, and they actually just passed their designation yesterday.
Yeah.
And then we've got a couple level 4s, Calico Rock and Fulton County are level 4 centers. So we get a lot of the patients from them that would need to go to a higher level care.
And for people that are listening out there, level 4, 3, 2, it just depends on the...
Yes, a level 4 is going to be one that doesn't have a lot of services. They're going to be basically a place where when the patient goes in, they're going to be able to control an airway, maybe stabilize that patient and get them onto another facility. A level 3 means that when the ambulance service goes out and they call back in and say, we have a trauma, at that point, we page the trauma team, which includes a surgeon, a trauma surgery team that comes down, lab, x-ray, and we have all that team together waiting when that patient arrives at the door. And so then a level 2 would be a center that had a neurosurgeon, neural trauma doctor.
By having this classification, do you have to have all of these professional people on staff 24 hours a day? Or how's that work?
Not necessarily. Some of them we do. Like obviously, we have to have a physician out in the ER. We have to have a certain amount of nurses that are have special training in the ER that has to do with trauma, and we also have to have a certain time frame. Like the surgeons are supposed to respond within 30 minutes, and anesthesia responds within a 30-minute time of being called. So we don't have to have them 24/7, but there are different ones. Like I said, the nurses need to be there, so it's kind of a mix of both. But we pride ourselves on all of our nurses that are 100% trained in the TNCC is what it's called, and it's a trauma course for those nurses.
So there's extra training that you have to go through in order to
you're
maintain
required to be 80%, and we have 100% of ours. And then all of the ER doctors and the surgeons maintain their advanced trauma life support class, which is the ATLS, and they are only nationally have to have it once, but ours are maintaining it yearly. So
you know, we're very fortunate in this area that we actually have every service that a level 2 needs, with the exception of a neurosurgeon. So Baxter Regional has got every service that you're going to get at level 2, with the exception of that. So a lot of our patients that are going to be taken to level 1, which would be the ones with head injuries, are going to be just that, patients that have head injuries or maybe burns, because we do not have a burn center in the area, of course, or a spinal fracture, like a neck fracture. But anything else can pretty much stay here now.
Have you since you attained that classification, have you had the situation to use that?
Yes, several times. Actually, I think we've activated our trauma team 4 times in the last 3 days. So
Yeah.
In the last 3 days?
Yeah.
last 3 days.
Okay,
It's been a very busy
it's,
few days.
it's going to be a great thing for you.
Yes, it is.
Oh.
It's something we've used it quite a bit.
Okay.
And it's, we've been really trying hard to get the word out to the community, do some public service announcements when it snows or things like that. We try to make sure that the community knows to be careful of, falling. We also are putting out classes about being careful with rugs and things like that people
Those are
trip
called
over.
throw rugs, aren't they?
Yes, yeah.
They will
Yeah,
throw
They
you.
throw you right down, yeah.
Yeah, that's a big part of that. A big part of what my job and Lacey's job is to do injury prevention. We're working with some of the area fire departments and police departments and others right now. I don't know if you remember a few years ago they put on what they call the Last Dance. We're in the process right now of getting that all put up for the spring. We do a lot with Safe Setters, which is a class that Lacey teaches, and we work with the fire departments in area ambulance services to make sure that they have the education they need.
And that is a huge part of making this whole
Huge
thing work,
part.
is the education
Huge
part
part,
of it.
because if
Yeah.
we can prevent you from having to use that center, we've done our job.
And to let people know, I think knowing this trauma center has been updated and it's a level 3 now, they don't necessarily have to do anything special to call you
No.
other than
No,
call
just
911.
call 911.
It
Right.
doesn't change a thing in the way you ask for emergency services.
No, just the same.
It doesn't.
And we're, of course, they're 24/7, and we have them day and night, and we're there to help them anytime they need anything. And
And I'm going to be in trouble if we don't mention Melody Sykes. Melody is
Yeah.
our trauma registrar. And when we have patients that come in, she's the one that actually puts them into the state data bank so that the state can track all of our statistics just to kind of see. And then we'll use those statistics later on to decide, do we have a lot of falls? Do we need to have injury prevention with falls? Do we need to have injury prevention with texting and driving? So we kind of use all that information as well as the state does. So.
Like the move up to level 3, was that brought about because the Cline Center, there was a specific need or was it just distance, or did you guys just set that as a goal and work to be
Statewide,
there?
there's been a huge need for this for years.
Okay.
I've actually been a paramedic in this area, worked as a paramedic with the ambulance service for the last 20 years prior to going to nursing school. And we've needed this for years, and it's just now finally statewide, they're just realizing, hey, wait a minute, we're the only state left in the nation that doesn't have a trauma system. And so we've kind of worked on that, and we're now far above and beyond what other states are even in our level. So we're actually in good shape as a statewide. The state's been really good about making sure that it was funded, making sure that the hospitals and the regional areas had everything that they needed to get this on board and get going. So it's been really, really easy and nice to work with.
Good.
And where we're positioned in the state, of course, is a need too, because otherwise it's kind of far to the east and west of us, or the north or south. So we're kind of perfectly in a perfect spot to make sure we provide that for our patients. And the level 4s, with the trauma system in place, what happens then, instead of stopping at those, they just come straight to us, so that saves time for the patient, that we can help them versus them stopping somewhere else. Because even if they're helping you a lot when you stop, you're wasting time to get to a level where we can further take care of you, like get you to surgery, get you to the orthopedics, things like that. So.
And I think that's one of the reasons why they wanted to implement this, is to cut down on a minute, 2 minutes, 3
That's
minutes.
right. In trauma, you're dealing with the golden hour. You have an hour. The optimal time is an hour from the time the injury occurs until you're in surgery. So by doing this, we're able to cut down on that time. A patient in the past who might have had an accident over, say, around Jeep or in that area, may have went to Fulton County, a level 4 now, where now they'll come straight to a level 3. They'll just come straight on into Baxter.
Or if they had a severe head injury, they might bypass
they
a
might
level
bypass
3
both and go all the way
and
to
go
Springfield
straight.
or Little Rock to a level 1.
And save that precious
That's
time.
right.
That's
Yeah.
so true.
And I'm sure there's times when they've gone to a facility and that service is not there.
Yeah.
And even us, sometimes, they'll come to us and you don't know what all you have until they get there. And so we do transfer some people out even after they've been here. But we stabilize them, get them any emergent care they need, and send them on. And like we said, the surgeons respond to the calls and come and meet them there. And so that, frees up another physician to keep taking care of the patients in the ER. And of course, if it's a bad enough trauma, they're there to help each other. And there's, a surgeon and an ER doctor there at the same time.
Yeah.
Yeah, it's been great here at Baxter just doing this, because the whole hospitals came together. When we have that happen, we have ICU nurses that come down and help. We've got the other departments that come in to help. So what's nice is it's not just an emergency room event, it's an entire hospital event. The surgeons have been awesome to work with, so they come in, they're out there to help us. Surgery has come down and helped us right away. So, you know, Baxter Regional, all of our employees need to be very proud of what we've done because they have really all stepped it up to make this not just an ER event, but an entire hospital event.
Well, it's a great addition, great service.
It is.
It cuts down on the response time, and you know, we fail to realize what great service we have here in America, and this is just a great example of that. Thank y'all for being here.
Thank you so much for having us.
Appreciate it so much for being here. Yeah.
Thank you.
All right, let's take a break, and we're going to talk with Kevin.
Now we're going to Marianne.
Oh no, let's go to Kevin.
Go to Kevin next?
I
Want
want
to save Marianne? Okay.
Let's save her for last.
Okay. You're going to visit with her this time.
I will.
You'll
I
get to
want
run off
to.
because we don't have an animal.
I want to talk about Kevin's book. He's published a new book. It's a photographic journal, I guess. Coffee table. Nice one there. We'll talk about that when we come back. Kevin Pieper in a couple minutes.